webinar on a webinar session on basics of fluid therapy in clinical practice. For this event, we have our research person as Dr. Ranjita Bastola. She was a part of past executive committee of IBC Rampur as well. She worked as the exchange officer of IBC Rampur in her college years. She has experience in small animal practice, mainly during the internship in WBS. So she is here to share some basics about the fluid therapy that we often lack in our college, and that would help us to accomplish the gap between the practice and the theory part. Without delay, I would like to hand over this platform to Dr. Ranjita Bastola. Didi, you can share your screen and start now. Thank you.
Thank you so much, Somnath bhai. सबैजनाले भिडियो चाहिँ अन गरिदिनु होला है.
Didi, I would like to request that there are some international participants as well. So today we should do this webinar in English language. So it would be more feasible for everyone.
Okay, no worries. Could you all please keep your video on so that I'm just talking to people, not the black board. Yeah, thank you so much for understanding. Let me just share the screen, okay? Can you all see? Yes?
Yes, Didi. Yes.
Yeah, okay. Let me just introduce myself. I'm Dr. Ranjita Bastola. I graduated from Agriculture and Forestry University. I'm a small animal veterinarian. I would like to introduce myself as a small animal veterinarian. I was associated with IVSA, Nepal and Rampur both. In IVSA Rampur, I was working as a secretary, and then in IVSA Nepal, I was working as a treasurer, and also I was working as an exchange officer as well. So after that, I worked at Sneha's Care for some time, and then I went to Worldwide Veterinary Services India, and I worked for 1.5 years over there. Okay. Yes. So let's not do any further delay, and let's move to our today's webinar, which is on fluid therapy. So basically today I will be covering, I will be giving only insights on basics of fluid therapy. The rest of the readings will have to be done by all of you, all of the participants. This will not be very deep and very extensive form. Okay, this will be just insight, just stimulating you all so that you know where to go and what to study. Okay. And also I want to give heads up that this webinar could be long, and there are a lot of slides, so you might get bored, but don't be. I'll try my best not to bore you all. Okay, let's begin. Fluid therapy. So this is the overview of my presentation today. First, I'll be talking about basics of fluid therapy, which will include indications of fluid therapy, distribution of body fluids and electrolytes, movement of fluid, terminologies, types of fluids, dehydration versus hypovolemia, and then I will move into second section, which will be fluid therapy in practice. So over there, I'll be covering resuscitation, dehydration, and maintenance, fluid therapy examples, and the complications of fluid therapy. So can anybody volunteer and define fluid for me, please? Please volunteer, otherwise I'll call out the name. Anybody would like to volunteer and define what is fluid, please? Okay, Pratik Kizu, are you with me? Pratik? Please unmute yourself and talk. Yes. Pratik, could you please? Yeah, Pratik, could you please define what is fluid? I mean, what do you understand by fluid? See, I'll be trying to make this. I'm trying to make this session as interactive as possible. So please, you guys, cope up with me. Okay, can you please define what is fluid? Yes, Pratik.
So, fluid is anything that is liquid and acidic.
Okay, great. Thank you very much. You can.
So, fluid is anything that is liquid, and in this case, since we are talking about, the fluid is anything that is liquid, which doesn't have any shape or size, and in this case, we are talking about the fluid practice over small animal management practice. So in this case, fluid is
yeah,
okay,
okay, thank you so much. Yeah, I got the answer. Yeah, thank you so much. You can mute yourself. Yeah, basically fluid is that substance, as Pratik has already mentioned, which doesn't have any shape and size, also which can move, like which is always in constant flux. Okay, so basically that is the fluid. So here are top 6 indications for fluid therapy. Why do we need to think about fluid therapies? Because to correct dehydration, hypovolemia, distributed shock, renal failure, certain toxicities to remove toxins from the body or flush out toxins from the body, and hyperthermia, that is like higher temperature of the body, hyperthermia. Clear? Oh God. Okay, so this is the body fluid distribution. What happens is like we have to always calculate it in terms of body weight. Okay, so always 60% of the body weight is body fluid, and remaining 40% is dry matter. Okay, and another one is okay, in this 60% is distributed amongst extracellular fluid and intracellular fluid compartments. So extracellular fluid compartments will hold 20%, whereas intracellular fluid compartment will hold 40%. Among that 60%. So we do not talk about, or we do not discuss about intracellular fluid when we are talking about fluid therapy in practice. We only talk about extracellular fluid compartment. Okay, because that is only the fluids which we will have access to and which we will be able to measure. Now moving into extracellular fluid compartment, we have 2 compartments: interstitial fluid compartment, and another one is intravascular fluid compartment. Interstitial fluid compartment will have 15% of 15% of extracellular fluid, and intravascular will have 5% of the extracellular fluid. So intravascular fluid will remain within blood vessel, while interstitial fluid will remain in between cells and blood vessels. Okay. So whenever there is loss of fluid from interstitial fluid, that will result dehydration, and whenever there is loss from intravascular compartment, that will result in hypovolemia. Good. Okay, so whenever I'm asking good and okay, please somebody unmute and say okay or not okay. Okay, then only I can move ahead. Yeah, this is one of the example. Sorry, this is one of the example. See, in case of 10 kg body weight of in case of a 10 kg dog, the total body water will be 6 liter, and then that will be divided into 4 liters of intracellular fluid and 2 liters of extracellular fluid. And again, extracellular fluid will be divided into 1500 ml of intracellular fluid and then 500 ml of plasma, or 1500 ml of interstitial fluid and 500 ml of plasma or intravascular fluid. Okay. Similarly, in case of cats, there is given like that. Is it clear?
Yes, Didi.
Yes, thank you so much, Dima. See, this is the, now let's move to movement of fluids. So how they move, right? IVF stands for intravascular fluid compartment. So from IVF to ISF, that is both falls into extracellular fluid compartment, right? So in case of extracellular compartment, within extracellular compartment, the fluids will move passively, okay, like water or other electrolytes, except protein, they will move very freely. There will be passive transport. But when it comes to interstitial fluid compartment to intracellular, or let's say extracellular fluid compartment to intracellular fluid compartment, because there is lipid bilayer membrane, it will require active transport. The energy will be required to shift in fluids. Is it clear?
Yes, Devi.
Okay, this will, yeah, good. This will make you more clear. यो के यो कस्तो डिस्टर्ब गरिरहेछ भने कसरी हटाउने हो?
के भयो दिदी?
1 second. One second. Now it's fine. Yeah, so this will make you more clear distribution of electrolytes in body compartments. So see, electrolytes can move freely in between intravascular fluid compartment to interstitial fluid. Thus, concentration is roughly similar, mostly due to permeability of endothelial layer of blood vessels. Okay, endothelial layer ko चाहिँ के हुन्छ त permeability भन्दाखेरि तिनीहरुले चाहिँ 0.5 to 5 nanometer सम्मको diameter भएको. Sorry, I'm so sorry, I'll explain it in English, okay? So what happens is, in case of endothelial layer, they have like, they can permit 0.5 to 5 nanometer diameters particles to pass from them, okay? So, see, we can see this extracellular fluid. This will include both interstitium and intravascular. यो कस्तो डिस्टर्ब भयो भने कसरी मिलाउँछ हो?
पोइन्टर आयो दिदी, पोइन्टर?
नो, यो भिडियोको प्यानल चाहिँ भइराखेको छ के?
त्यो त्यहाँ उ हुन्छ, त्यही त्यसको साइडमा हुन्छ, त्यसलाई हाइड गर्न मिल्छ, त्यहाँ एकचोटि ट्राई गर्नु त।
फेरि हाइड गरे भने चाहिँ मलाई हेर्नै पाउँदैन मैले।
त्यो बिचमा आउँछ, त्यो भयो भने ठ्याक्क त्यो यता साइडमा आउँछ कि। तपाईलाई जस्तो सजिलो हुन्छ त्यही गर्नु न।
अनि फेरि त मेरो स्लाइडलाई पनि छेकिरहेछ के यसले।
त्यो भयो भने त्यो हुन्छ, हाइड गर्नु न, अनि केही बोल्नु पर्यो भने अगाडि आइहाल्छ नि।
के रमाइलो हुन रहेछ त। ओके
दिदी स्क्रिनमा चाहिँ डबल क्लिक गर्नुस् न, अनि अर्को फर्मेट आउँछ है।
ए हो, आउन के भयो यार। 1 second. Okay, let's just move. So yeah, what I was saying was the endothelial permeability is 0.5 to 5 nanometers. So whatever particles which has less than diameter of 0.5 to 5 nanometer, or equal to 0.5 to 5 nanometer, they will be easily permeable in between intravascular fluid to interstitial fluid compartment. Okay, so see, there are some ions, electrolytes in extracellular fluid and other intracellular fluid. Okay, so you can make out that which one is extracellular electrolyte and which one is intracellular electrolyte, right? So sodium is extracellular electrolyte, potassium is intracellular electrolyte, calcium is intracellular, magnesium is intracellular, chloride is extracellular, bicarbonate is extracellular, and those all both of the phosphates are intracellular, and protein also intracellular, right? Yeah, see, so what other points is however, protein cannot pass through endothelial layer because obviously protein will have a greater diameter than 0.5 to 5 nanometer. This will create an osmotic gradient and will keep fluids in intravascular compartment. Okay, so osmotic gradient भनेको चाहिँ osmotic pressure जस्तै later on you all will know about it. So that is the thing. And other point is I have already explained that from ICF to ECF or ECF to ICF, active transportation is required. That is why there is huge concentration difference in between electrolytes, right? But in case of intravascular and interstitium, there is no such difference. There is like they are always in equal or balanced way. So balance in between these electrolytes in our body fluid compartment is called homeostasis. Okay, balance in between all those electrolytes in between extracellular fluid compartment and intracellular fluid compartment is also called as homeostasis. Is it clear?
Yes, Didi.
Let's move into some of the definitions. Okay, this is like too much of words, but these are like not very important. These things you should have known already. I just mentioned considering about our college and all. So yeah, let's know about concentration. So it refers to the amount of substance that is present in a specified volume. Okay, substance is expressed in either mass or moles or equivalents, whereas thank you so much. Who is that Poco phone? Please give your name, please. I have to know your names. Expressed in liters, deciliters, or milliliters. So osmosis, it is the net diffusion of water from a region of higher water concentration, which will have low solute, to lower water concentration, which will have higher solute across a semi-permeable membrane. Are you all clear on the concept of osmosis?
Yes, Didi.
Can anybody volunteer and explain what is osmosis in a much more simpler way? So please, osmosis is very important to understand fluid therapy. Okay, you have to have a clear understanding of osmosis and diffusion to understand fluid therapy. Sorry. Nobody wants to volunteer. So sad. Okay, yeah, please.
So basically, simple osmosis differences in the compartment compartment energy difference solute त्यसमा चाहिँ अब ब्यालेन्स त्यो अब डिफ्युजन भने के अब एन्ट्री भनेमा त्यसमा चाहिँ बुझिन्छ है अन्डरस्ट्यान्डिङमा चाहिँ मेनली चाहिँ एनर्जीको बारेमा सोल्युटले गर्ने फ्री एनर्जी
yeah, okay, good. Anybody else would like to volunteer?
Diffusion of water from higher concentration to lower concentration across the semi-permeable membrane. Semi-permeable membrane हुनुपर्छ त्यहाँ चाहिँ सोलुट चाहिँ जुन ठाउँमा कम छ त्यो ठाउँबाट हायर सोलुट भएको ठाउँमा वाटरको वाटर चाहिँ मुभ गर्नलाई osmosis भन्छ.
Yeah, true. Okay, good. So osmosis is basically diffusion of water from from higher water concentration to lower water concentration. Lower water concentration भएको ठाउँमा चाहिँ के हुनु पर्यो त higher solute हुनु पर्यो के. Okay, let's move to osmotic pressure. It is the precise amount of pressure required to prevent osmosis or net diffusion of water through a membrane. Okay, so earlier I had mentioned that protein act as osmotic gradient, right? Protein act by creating osmotic gradient, right? So what protein does is it prevents the osmosis of water. Okay, am I making sense?
Yes, Didi.
Yeah, good. So that is osmotic pressure. Animal cells have an osmotic pressure approximately equal to that of circulating blood. Therefore, the fluids normally do not flow out of intracellular compartment. All right. It is expressed in terms of either osmolality or osmolarity. The osmotic pressure exerted by colloids, that those are the large non-permeable molecules at the membrane, is colloid osmotic pressure or oncotic pressure. So remember this term also, okay? Colloid osmotic pressure or oncotic pressure. So osmolarity is the measure of number of osmotically active particles per liter of solution. So osmolol per liter. And osmolality is the measure of number of osmotically active particles per kilogram of solvent. So see, osmolarity is per liter of solution and osmolality is per kilogram of solvent. Okay. Now let's come to tonicity. Tonicity is the ability of an extracellular solution to make water move into or out of a cell by osmosis. All right, this is very important. Okay, this is very important to understand about tonicity. So whatever fluids we are going to talk about the types of fluids. Whatever we are going to talk about, it will be based on this this particular characteristic tonicity. Okay. So again, I'll repeat, the ability of an extracellular solution to make water move into or out of a cell by osmosis is known as its tonicity. Okay. Anyway, so colloid osmotic pressure or oncotic pressure, just like osmotic pressure, but it is the concentration of protein within that space which influences fluid retention within a compartment. All right. Earlier, I have already given the example of protein. I mean, albumin or protein. So hydrostatic pressure, pressure generated by the force of fluid within a compartment which influences fluid movement from the compartment. This all, I think everybody knows about this, right? Okay, anybody has any doubt or anybody would like to read again or anything like that? No, okay, let's move to next slide. Routes of fluid administration. There are 5 routes of fluid administration. यो हटाइदिनु न प्लिज, यो कसले अघि ड्यास गर्नुभएको थियो, कलर हाइलाइट गर्नुभएको थियो. One is oral, another one is subcutaneous. Oral, okay, I'll just describe this also. Oral is basically for those cases which where they do not have vomition and the dehydration is very, very mild. I mean, very less, that can be corrected with oral therapy only. And also for the patients who have active and functional gastrointestinal tract. Okay. And another one is subcutaneous. So subcutaneous is for mild dehydration and it is not very best one and it's contraindicated in patients with infected or devitalized skin, hypothermia, the patient that requires dextrose. and severe dehydration. So for all those patients, subcutaneous will be pointless, will not be useful. In fact, if we do subcutaneous in such patients, then we will be jeopardized. We will be we will be risking the health of the patient. Okay. So another one is intravenous. So intravenous route is the best of all of them. Yeah, that's all. And another one is intraperitoneal. So for mild to moderate dehydration, we can use this, and we have a risk of hitting internal organs. Intraosseous is for patients with poor venous access. For small animals or neonates, we can inject on the head of the femur or humerus. Basically, on the head of the long bones, it's preferred. And I have seen them doing it in birds mostly, like where I was practicing. Yeah, so let's move to this interesting concept. Are you all clear about hypertonic, isotonic, and hypotonic? Does anybody know about it from the beginning, or they would like to share over here what they understand? No. Okay, cool. Then I'll only share it. I'll only talk about it. Yeah, so whatever we are talking about, those fluids or this concept, we will be comparing it with normal plasma osmolarity or osmolarity. Okay, so plasma सँग चाहिँ हामीले compare गर्ने हो है जति बेला पनि. So let's move to hypertonic fluids. So in case of hypertonic fluids, these hypertonic fluids will have higher osmolarity as compared to plasma. Hypertonic fluids will have lower water concentration but higher solute concentration or higher electrolyte concentration. So whenever a cell is placed on a hypertonic solution, because hypertonic solution does not have, hypertonic solution have lower water content, the water content of cell will move out of the cell. Is it clear?
Yeah. Yes.
Yeah. So what will happen is whenever water sift out from the cell, then cell will shrink. Okay, because there is no fluid, so cell will shrink. In case of isotonic solutions will have equal osmolarity as that of plasma, and equal number of solutes and equal water contents. It will be all equal. So cell will not lose its shape and size, but there will be some kind of balance. Okay, and this could be used to keep the cells in. Keep the size and size and shape of the cells intact, and also to treat the volume deficit. And this is a very popular. These isotonic solutions are very popular ones. Okay, in our practice. Now another one is hypotonic solution. Hypotonic solution. What happens over here is hypotonic solutions will have lower solute concentrations but higher water. So as compared to cells, and this will have lower plasma osmolarity. So what will happen is water will go inside, water will sift inside the cells. The cells will be swollen because of the excessive water, and there will be high risk of bursting of cells. So whenever there is already existing edema, or whenever there is already existing cerebral edema or effusions, in such cases we would want to avoid hypotonic solutions, because they are going to give more water to our cells, and that will cause cell death. Am I clear?
Yes.
Okay, good. See, in this picture also you are seeing, in case of hypertonic, the cell is shrinking. In case of hypotonic, cells are happy within their shape. And in case of hypertonic, cells are swelling, and some of them are also trying to burst and on the way to die. Now let's move to types of fluids. So mainly there are two types of fluids in practice: crystalloids versus colloids. So basically, crystalloids are you can just understand crystals. So crystals are obviously smaller ones, and another one is colloids. Colloids are bigger ones, large molecules. Crystalloids are water plus electrolytes, which are also water soluble molecules, and colloids are large insoluble molecules. Okay. Crystalloids are permeable to the capillary membrane. That means they will immediately, they will take no time to move from intravascular compartment to interstitium compartment. Okay. And colloids are impermeable to the capillary membrane, hence stays in one compartment. So basically, we are going to give colloids in intravascular compartment, right? So they will stay inside intravascular compartment and not go to interstitium. Crystalloids are very simple and quite affordable and cheap, but colloids are complex and expensive and very difficult to find one in veterinary practice. Crystalloids have no significant immune response till date. They have not noted it till date, but colloids have significant immune responses. Also, it varies animals to animals, so we have to be very careful. And crystalloids examples are Ringer's lactated Ringer's solution, normal saline, and DNS. And colloids are basically blood and blood products. It has starch, span, or other what we call plasma products or albumins, all those things, which are basically large molecules. So here I have one question. A significant percentage of crystalloids move into the interstitial and intracellular space within approximately 45 minutes of IV administration. Why? Can anybody answer this? Why do you think significant percentage of crystalloids will move into the interstitial and intracellular space from intravascular? Why do you think it happens? Who is going to answer?
Because they are of small molecular weight, so that they can easily pass the capillary membrane.
Who is this talking? I cannot see. Very भन्नुस् Who?
Crystalloid basically electrolytes हुन्छ हैन, अनि त्यो चाहिँ एकदमै स्मल मोलिकुलर वेटको चाहिँ कम्पाउन्ड हुन्छ, अनि क्यापिलरी मेम्ब्रेनबाट चाहिँ इजिली त्यसले चाहिँ पास गर्न सक्छ के, त्यही भएर हो.
Exactly, true. Very good. Well done. Thank you very much. Yeah, let's move to other slide. So blood is the standard fluid. So whatever we are going to talk about, we are going to compare with blood, okay? Or plasma. The values will be compared with plasma values. See, crystalloids. So these are on the basis of osmolality. We have three types, or tonicity pani bhannaले. It's like there are three types of crystalloids. One is hypotonic, another one is isotonic, and next one is hypertonic. All right, hypotonic will have lower osmolality than plasma. Fluid will shift from ECF to ICF. To treat hypernatremia, we can use hypotonic solutions. And examples are 5% dextrose in water, half saline, plasmalite 56, or normal sol M. And isotonics are, they have osmolality same as plasma. No fluid shift from ECF to ICF will occur, but there could be a fluid shift from interstitium fluid compartment to intravascular fluid compartment, or vice versa. All right. Okay, okay, good. The examples are our very famous normal saline, 0.9% normal saline, lactated ringer solution, and 5% is dextrose in water. Now let's talk about hypertonic crystalloids. So they have osmolality higher than plasma. Fluid will shift from ICF to ECF1. You could say if you have to pull out fluids from the cells, then you would want to use hypertonic solution in case of like cerebral edema, or even in case of shock, because we need to maintain intravascular volume, blood volume in case of shock, right? So in that case also we can use hypertonic solution. So examples are 3% NaCl, or 3% is normal saline, sorry, I wrote NaCl, and 5% is dextrose in half NS, 5% is dextrose in NS, and D5, 5% is dextrose in lactated ringer solution. Cool. Let's talk about colloids. Sorry.
Go on.
Yeah, okay. You can drop a question in the chat box, or you can just unmute and ask me, okay? Let's move to colloids. So this is also referred to as volume or plasma expanders, which contains large molecules impermeable to the capillary membranes. We have already discussed that the capillary membranes will only permit molecules with diameters ranging from 0.5 to 5 nanometer or less than that, right? So they have high oncotic pressure, which displaces the water molecules, creating water deficit in intravascular compartment, leading to shift of fluid from ISF, interstitial fluid compartment, to intravascular fluid compartment, thus correcting intravascular volume deficit. Is it clear, this point?
Yes.
Okay, good. Another one is, sometimes what happens is we have certain patients who are intolerant to large volumes of fluids. So in such cases, if we want to make our treatment effective, and if we want to achieve the greatest cardiovascular benefit with least volume of infused fluids, then we can go with colloids. But we have to be very careful about using colloids, okay? Because they have significant immune response. All right, here. Yes, no.
Yes, Didi, yes.
Good. See, these are very basic things, okay? I have to make sure that you guys understand. So as of a main basic point, explain because it's a very deep, I mean, you have to keep reading. Each time you will each time you read, you will find something new. So I'm just trying to provide basic insight, or basic concept. So please respond when I ask. So there are natural or synthetic. Whole blood and plasma transfusion, those are natural ones, which increases intravascular fluid compartment or volume, and perfusion when RBCs are abnormal, okay? When RBCs are abnormal, yeah. And another one is albumin, obviously, and another one is starch, dextran, oxyglobin, which are synthetic, which also increases IVF and perfusion when RBCs are normal. RBCs are normal now. We can go for blood components. When RBCs are normal, we can go with all other synthetic colloids. So in case of resuscitation and hypoproteinemia, we can use colloids. For each ml of colloid given, vascular volume increases by 1 to 1.5 ml. And this have potential harm when we have capillary leak disorder. So whenever capillaries are intact, we know that, then only we can use colloids. Everything comes with pro and cons. Okay, so let's move to this table. This table might look a bit complex, but I will explain it to you. See, what I said earlier was blood is the standard fluid. So see, we are taking plasma to compare with all of the fluids we have. All right. So see, the pH of plasma is 7.4, sodium 145. See, the values might fluctuate according to our references. I have taken this reference from today's veterinary practice magazine. Okay. Sodium is 145. Plasma has chloride of 110. Potassium 4, magnesium 3, calcium 10, and osmolarity is 280 to 310. See, osmolarity is the most important, all right? Here I will also talk about balanced and unbalanced fluid. So see, you can see the 0.9% saline. The osmolarity of 0.9% saline is 308, and osmolarity of plasma ranges in between 280 to 310. So it is like it is equal to plasma, right? So what I had mentioned earlier, what is that fluid if they have equal osmolarity to that of plasma? Isotonic, hypertonic, or hypotonic? Can anybody tell me what is that?
Almost isotonic.
Yeah, who is this? Can you please tell again, please?
Hello, yes, this is isotonic.
Okay, fine.
बोल्ने मान्छेको भिडियो अन गर्ने कम्पलसरी गर्नु पर्यो
बिने भाइ हो दिदी
Hola, very good, very good. Yeah, this is isotonic. Yeah, very good. So this normal saline is isotonic because this has equal osmolarity as that of plasma, right? But let's talk about balanced and unbalanced. Okay, so whenever we are talking about balanced and unbalanced fluids, we are talking that those fluids will have equal components as that of plasma. All right. Sodium will be equal to that of plasma, chloride will be equal to that of plasma, potassium will be equal to that of plasma, and other things. So see, in case of a normal 0.9% saline, it is isotonic, yes, but see the PS is not equal to plasma. Are you following me on the table?
Yes, Devi.
Can you see the cursor I have placed on the pH?
Yes, Devi.
Yeah, very good. So 0.9% saline has 5.5 pH, but plasma has 7.4. Sodium 154, but plasma has 145. Chloride 154, but plasma has 110. Potassium 0, plasma 4. Magnesium 0, plasma they have 3. Calcium 0, plasma has 10. So see, this doesn't meet. This doesn't meet with plasma, right? This doesn't balance with plasma. So we have to tell it as unbalanced solution. Isotonic, unbalanced crystalloid. Is it clear?
Yes, Devi.
Okay, so I would like one of you to volunteer and tell me whether the 0.45 saline is whether hypertonic, hypotonic, isotonic, balanced or unbalanced. What it is? Can anybody volunteer and tell me? See, I'll call out name. Please volunteer and tell.
Hello,
Hypotonic?
Yes, hypotonic, okay. And it is unbalanced.
Yeah, very good. Hypotonic and unbalanced. Good job. Thank you. So I think all of you can now differentiate, right? Isotonic, hypotonic, hypotonic, balanced and unbalanced, right?
Yes, Didi.
दिदी क्यान वी टेक त्यो प्लाज्मालाइट ए को पनि यसमा चाहिँ के हुन्छ
प्लाज्मालाइट ए भनेको चाहिँ सी प्लाज्मालाइट ए मा चाहिँ के हेर्ने त सबैभन्दा फर्स्टमा अस्मोल्यारिटी हेर्ने अस्मोल्यारिटी हेरिसकेपछि it falls in between 280 to 310 so it is an isotonic solution. Okay, isotonic solution, and this is this is unbalanced, slightly unbalanced. Okay,
yes, Didi.
Yeah, so here I have mentioned, this table has mentioned about the use of this solutions also. See, we have this our very famous lactated ringer solution. Okay, I find this solution very safe to use in case of shock, or in case of normal dehydrated patients also. I find it very safe and it's very useful. Lactated ringer solution is slightly hypotonic, but it is anyway considered as isotonic one only. Unbalanced isotonic solution, slightly unbalanced, and it gives lactate also, which acts as buffer, and this is used in replacement, as well as you can use in resuscitation also. And this is very safe, even though it gives lactate, it does not promote lactic acidosis. I mean, it does not worsen the case of lactic acidosis or all other things. Okay, so just have to be careful when there is liver disease, but again, it's safe, it's quite safe. Okay, let's move to another slide. Yeah, I want to talk about dextrose containing crystalloids, dextrose containing fluids. So in case of dextrose containing fluids, dextrose will be released after, dextrose will be metabolized and it will add calories. And then we have to be very careful while giving dextrose, okay? So 5% dextrose will have 50 gram per liter, which 50 gram per liter of dextrose, which will give 170 calorie per liter, and 10% will give 340 calorie per liter. One tricky thing about dextrose is, even though it is isotonic 5% dextrose in water, it will yield free water, which is obviously hypotonic after dextrose metabolism. So see, we are thinking that we are giving isotonic D5W, but in the end, in the body, it will turn, like, it will create some hypotonic atmosphere. So again, we cannot give this when we have edema, we have cerebral edema, or whenever the animal has conditions which is contraindicated to hypotonic solutions. Okay. So another one is, we are giving hypertonic D5 half NS, which will yield half NS, which is also hypotonic after dextrose metabolism. And we are giving hypertonic D5 lactated ringers, which will yield lactated ringer, which is also isotonic after dextrose metabolism. So we have to be very, very careful while using dextrose. And it is contraindicated in subcutaneous route, as it will cause clogging of the skin and abscesses, and it is also contraindicated in diabetic patients, or it requires close monitoring. Do I make sense? Am I making sense on this? Is it clear?
Did you 2 number ko jali bhandiनु hypotonic to NS सँग?
Yeah, so 2 number मा चाहिँ के भयो भन्दाखेरि D5 half NS भनेको चाहिँ hypertonic हुन्छ है. यसको osmolarity चाहिँ प्लाज्माको osmolarity भन्दा हाई हुन्छ बेसिकली. ओके, तर जब हामीले यसलाई दिन्छौं अनि बडीमा जान्छ, बडीमा गइसकेपछि त के हुन्छ त, मेटाबोलिजम हुन्छ नि त अभियसली. सो मेटाबोलिजम हुँदाखेरि चाहिँ डेक्स्ट्रोज र हाफ एनएस चाहिँ टुक्रिन्छ क्या दुईटा उसमा. अनि डेक्स्ट्रोज चाहिँ क्यालोरिजको लागि युज भयो, तर हाफ एनएस चाहिँ बडीमा हुने भयो नि त. सो हाफ एनएस will create hypotonic environment, right? This is a extracellular solution, right? This will create hypotonic environment. Hypotonic environment भइसकेपछि के हुन्छ त भन्दाखेरि cells मा चाहिँ बाहिरबाट वाटर के गर्ने भयो भित्र जाने भयो. So that might cause what swelling in the cells and damage to the already swollen cells. Clear छ? For example, cerebral edema भएको छ हैन. Cerebral edema भएको बेलामा चाहिँ के हुन्छ त cells मा already water content access हुन्छ हैन. We have to focus on taking out water content from those cells, right? But if we give hypertonic D5 half NS, then this D5 5% dextrose will be used up as calories, as energy, right? But half NS will create such an environment where more water will go into the cells, and that might cause more harm, like cerebral edema भएको बेलामा cells burst हुन सक्छ, cell death हुन सक्छ, अनि त्यसपछि अब त्यो animals पनि death हुन सक्छ. Okay, that will not at all help animals. Our fluid therapy protocol will not at all help that animal. Is it clear?
Yes, Didi.
Yes, so let's move to this slide. Here, what I wanted to say, what I wanted to talk about was basically pH of the fluid. So in case of formation, there will be loss of HCl, which will obviously cause in metabolic alkalosis. So what would you want to use? Which of the fluid you would want to use when there is alkaline condition? Firstly, भन्ने alkaline condition लाई करेक्ट गर्नलाई चाहिँ कस्तो खालको के गर्नुपर्छ हामीले? What do we need to do to correct alkaline condition, alkalosis, metabolic alkalosis? Nobody knows. Okay, see, because the simple, okay, it's very simple. If there is alkaline condition, then we have to give some acidic solution so that it will correct that alkalosis. Okay, so we are going to give normal saline. Alkaline metabolic alkalosis भएको बेलामा चाहिँ pH बढेको हुन्छ. So we have to reduce the pH. That's why we have to give some acidic fluids. So here normal saline has pH of 5.5, which is also acidic, right? And which also has chloride, and that might help in correcting loss of chloride as well as metabolic alkalosis. So in case of diarrhea, there will be loss of bicarbonate, and there will be metabolic acidosis. So to correct that, we need some kind of alkaline solution. That could be our lactated ringers solution, or RL. RL and lactated ringer solution are same, right, guys? Is it clear, or I need to explain more?
Clear.
Yep. Okay, so let's move to yeah. I want you all to just remember this, what I had told. Dehydration is loss of interstitial fluid or total body volume, water, and hypovolemia is loss of fluid from intravascular compartment. And also severe dehydration leads to hypovolemia, resulting in shock and death. All right. यो सबैलाई याद छ नि है?
Yes, Didi.
Yeah, so let's move towards what it is. Last year, anyway, so let's differentiate in between hypovolemia, or let's learn about it. Hypovolemia is basically loss of volume from intravascular compartment, okay, from blood vessels. It could be because of severe blood loss or hemorrhage, or that conditions where there is no, that condition which is creating volume deficit in blood vessels. And sometimes severe dehydration leads to hypovolemia. यो चाहिँ कसरी हुन्छ भन्दाखेरि severe dehydration leads to hypovolemia. कसरी हुन्छ त भन्दाखेरि whenever there is severe loss of fluids from interstitium, that could be because of excessive diarrhea or vomition, which occurs in parvo puppies. Okay, listen to me very carefully. Which occurs in parvo puppies. There is like severe loss of fluids or electrolytes from interstitium. So that might cause that whenever there is less water content in interstitium, then from intravascular compartment water will shift to interstitial compartment. So that might cause hypovolemia. That basically occurs in case of parvo puppies, and they die. So predisposed to hypovolemic shock and renal failure. So in case of hypovolemia, following signs will occur. That is, first one is tachycardia. In case of dogs, first one is tachycardia. Later on, in terminal stages, when the dog is dying, then there will be bradycardia. Pale mucous membrane will be there. Weak peripheral pulses will be there. Altered mentation will be there. Prolonged CRT will be there. What is CRT? And does anybody know what is CRT?
Capillary refill time.
Very good. So capillary refill time normal has to be less than 2 seconds, but in case of hypovolemia, it will be prolonged. So it could be 2 seconds or more than 2 seconds. And there will be cold extremities, and there will be significant hypotension, and in blood work you will see elevated lactate. Okay, so basically in case of hypovolemia, there will be reduced oxygen delivery and reduced tissue perfusion. Okay, significant tissue perfusion. There will be reduced tissue perfusion significantly. So all those signs you will see, like you will have to relate it to that. But in case of cats, it is a bit different. Okay, listen to me very carefully. This is also called as triad of death. So there will be marked hypothermia, bradycardia, and hypotension. See, in case of dogs, you will find tachycardia and bradycardia only in terminal stages. But in case of cats, it will be bradycardia from the beginning itself, and hypothermia and hypotension. So I have handled such cases. So it's very significant. It's very marked. So you have to keep yourself aware and very attentive towards the signs. Now let's talk about dehydration. Dehydration is loss of total body water, including electrolytes, and it is also loss from all physiological compartments, but I generally focus on interstitium. So there will be dry mucous membrane. You have to always assess the mucous membrane during your physical examination, not just the color, but the whether it's dry, moist, or not. Touch गरेर हेर्ने के. And the abdomen will be doughy. It will be like pito मुस्दाखेरि जस्तो हुन्छ त्यस्तो टाइपको. And sunken eyes will have gone inside. We can also say inophthalmos. Skin tenting. So whenever you pull your skin like this, see, I'm well hydrated. See, that's why my skin is not tenting. So, but in case of dehydrated dogs or animals or even humans, if you pull your skin and make a tent like this, then it will remain as that. Okay, it will take some time to go down. So whenever you do blood work, there will be azotemia and elevated hematocrit and total protein. Okay, is it clear?
Yes, Didi.
Dr. Ranjita, म एकछिन डिस्टर्ब गरेँ है. सबैजनाले यो स्लाइड चाहिँ अलि राम्ररी हेर्नु होला, बिकज दिस इज भेरी इन्फर्मेटिभ हैन. जब आफू प्र्याक्टिसमा गइन्छ नि, यो स्लाइडको धेरै कुराहरू थाहा नपाएर पनि कहिलेकाहीँ चाहिँ हाम्रो यो रङ डिसिजन हुन जान्छ क्लिनिक्समा. सो इफ यु हेभ एनी क्वेरिज डक्टर रञ्जितासँग क्लियर गराउनु होला है. थ्याङ्क यू.
Yeah, thank you so much. It's quite important, and I have worked really hard to prepare these slides for you guys. So please be attentive, and I'll just drink water and come back. Yes, Bima, please unmute and say.
यो हाइपोभोलेमियामा चाहिँ यो ट्याचिकार्डियाको कस्तो कन्सिक्वेन्सेस, यो फिजियोलोजिकल के रिलेसन छ?
See, hypovolemia हुँदाखेरि चाहिँ कस्तो हुन्छ भन्दाखेरि this cardiac load हैन के हुन्छ भन्दाखेरि hypovolemia is basically reduced blood volume in blood vessels, right? So whenever there is reduced blood volume, heart will have to work very hard. I mean, heart will have to pump out blood very rapidly. एकदमै छिटो छिटो चाहिँ के गर्नुपर्ने हुन्छ ब्लडलाई चाहिँ पुश आउट गर्नु पम्प आउट गर्नुपर्ने हुन्छ so that all of the vital organs including peripheral organs get oxygen or blood on time, right? That's why there we can see tachycardia.
And cats ma किन राख्दा opposite हुन्छ?
Cats ma because they have very low blood volume and that's the main reason I think. Yeah, Dr. Roxanne wanted to say something.
Please continue.
Okay, cats because they have very low blood volume. That's why, and I don't know yet. I mean, you know, I didn't find much literatures on that. They are very sensitive, and cats are very
At first, the oxygen requirement of body is very high during hypovolemia. So the heart needs to pump the little volume of the blood for the what to say. नेपालीमा भन्छ यार टिस्युमा चाहिँ अक्सिजन पुर्याउनलाई हार्टले कम भोल्युमबाट धेरैचोटि पम्प गरेर बल्ल गर्नुपर्ने भएर ट्याकीकार्डिया हुन्छ हैन तर त्यो ट्याकीकार्डिया गर्दा गर्दै पछि चाहिँ यो जुन मसल र पेरिफेरल टिस्युहरु छ उनीहरु चाहिँ युज टु भएकोले अब उनीहरुले चाहिँ आफैले अक्सिजन रिक्वायरमेन्ट कम गराउँछ सो त्यसपछि ब्राडिकार्डिया हुन्छ डगमा पनि पहिला ट्याकीकार्डिया देन फलोड बाइ ब्राडिकार्डिया हुन्छ भने क्याटमा पनि देयर मसल्स एन्ड देयर organs, they are easily adjustable for the oxygen requirement.
Okay. Thank you so much. Oh, yeah, please mute your mic, please. Thank you so much, Dr. Roxanne. That was very important information, and I'm sure Bima is clear now. So yes, yeah, very good. So now I hope you all will be able to differentiate in between hypovolemic and dehydrated patient now. Let's move to assessment of hydration. So how do we assess the hydration? Okay, so let's take yeah, so dehydration ko cha ke huncha ta bhandakari this is the percentage range which is basically used in small animal practice. Your 5 to 8% ma you can, I mean, they use like 6%, 8% त्यसरी हैन. In case of less than 4%, skin turgor will be pliable. Skin turgor bhaneko चाहिँ it's basically means what is this consistency, or you know how you feel when you touch it. And it's pliable. Skin twist will be less than 2 seconds. Whenever you twist the skin, then it will come down immediately. Skin tint also less than 2 seconds. It will come down immediately. Mucous membranes will be moist and warm. Eyes will be moist and dry. So whenever there is dehydration of 5 to 8%, the skin will be leathery. Ekdamai chamro type ko hunne हैन. Leathery. Skin twist will be less than 2 seconds, but skin tint will be more than 2 seconds. It will take more than 2 seconds for the skin to come back. Sticky but warm. Mucous membranes will be sticky but warm. Eyes will be dull and sunken. Yeah, and whenever there is more than 10% dehydration, it is also severe dehydration. Patient could be in hypovolemic shock. There will be severe loss of turgor. Skin twist will be indefinite. It will remain twisted only. Skin tint will be indefinite. It will remain tinted only. Mucous membrane will be dry and cold. and eyes will be severely sunken and there will be dry cornea. So torchlight liएर चाहिँ आँखा खोज्न जानुपर्छ. Okay, and then clinical signs such as mentation and pulse rates are also very important when we are assessing the hydration. Okay, is it clear?
Yes, Didi.
Yeah, thank you. Yeah, so let's move to the fluid prescription. Like in practice, how do we do it? How do we correct various fluid losses? So basically, there are 3 straightforward steps. One is resuscitation. Another is, first is resuscitation. Second, dehydration. Third is maintenance. Resuscitation. So basically, this is like for emergency conditions, when there is hypovolemia or when there is any other kind of shock or any sepsis or anything like that, okay, which is decreasing the intravascular blood volume. I suppose that everybody has understood that if there is volume deficit in intravascular compartment, then that is quite an emergency condition. Again, पनि Dr. Roxanne दाइले चाहिँ explain गरिसक्नुभएको छ हैन. So this is a kind of emergency condition whenever there is volume deficit in intravascular compartment. Okay, so we have to go for resuscitation, either IV or intraosseous. Other routes such as subcutaneous or peritoneal or oral fluid are not well absorbed because blood flow is diverted to the heart, lungs, and brain in a hypovolemic state, and we have to make sure that the volume deficit is corrected as soon as possible. So cats with hypovolemia should be actively warmed to a body temperature of at least 97 degrees Fahrenheit before administering large volume of fluids. Okay, the salk dose rate is 90 ml per kg per hour of total blood volume for dogs and 60 ml per kg per hour of total blood volume for cats, and this has to be administered in boluses by using either pressure bags or fluid pumps or syringes. Syringes of 60 ml syringes will be quite helpful. So while doing selection of fluid, we have to go for balanced isotonic crystalloids at first and then after colloids, because we do not know how the patient is going to respond with colloids, and there is like a good what to say, there is a good experience of correcting hypovolemia with balanced isotonic crystalloids only. Yep. Yeah, so how do we begin is whenever we finish our calculation or after calculating, we have to begin by rapidly administering 25% of the calculated salk dose at first, and then we have to reassess the patient for the need to continue and and when we are continuing, at each time we have to increase the dose by 25%. So first 25% we have to give as bolus, and then we will reassess the patient, and then if it requires more fluids, then we will increase by 25%. We will keep increasing by 25% after each reassessment. So how do we reassess is we have to re-evaluate for oxygen delivery restoration parameters. Okay, so we have to see for normal heart rate, pink mucous membrane, normal CRT, improved mentation, improved blood pressure, and improved serum lactate. Okay, so in case of patients, like whenever there is this type of case, the patient might have lost a significant amount of blood volume from intravascular compartment, but not from interstitium. So patient might be hypovolemic, but not dehydrated. Okay, so we can, if the patient is not dehydrated, then we can discontinue the fluid. Otherwise, we can continue with balanced isotonic crystalloids in tapering manner, like taper garde decrease garne, ekachoti झ्याप decrease नगर्ने, which is quite safe. Is it clear, everybody, this slide?
Yes.
Excuse me, Didi.
Yeah. Who is this?
Hello, can you hear me?
Yeah.
Hello.
Yeah. Crystal.
दिदी यो हाइपोभोलेमिक सक हुने बेलामा जुन ऱ्यापिडली बोलस दिने भन्नुभयो नि
Yeah.
त्यो दियो भने त्यसले हार्ट ओभरवर्क हुँदैन ओभरलोड हुँदैन हार्टको फङ्सन एक्कासी धेरै बोलस दियो भने
रिस्क त हुन्छ तर अलरेडी त्यहाँनिर ब्लड भोल्युम त कम नै भइरहेको छ अन्त त्यस्तो धेरै रिस्क चाहिँ हुँदैन त्यो यदि त्यो हेल्दी एनिमल छ भने चाहिँ त्यस्तो रिस्क हुँदैन इफ द्याट एनिमल हेज कार्डियक इस्युज देन या let's talk about hypovolemic shock. So, intravascular fluid deficit leads to inadequate oxygen delivery to the cells, leading to poor tissue perfusion, which is also a state of shock. Okay. So, untreated intravascular fluid deficit is life-threatening as oxygen is required for minute-to-minute cellular function maintenance. Inadequate oxygen delivery leads to hyperlipemia, that is also reduced pH due to anaerobic glycolysis, causing cell membrane disruption, eventually cell death, leading to organ failure. So resuscitation can save a life. So this is how we are going to save a life by resuscitation fluid therapy. Clear?
Yes.
बेसिकली के हुन्छ त भन्दाखेरि अक्सिजनको हरेक टिस्युमा चाहिँ अक्सिजनको कमी भएको स्टेट नै के हो त सक हो है अनि अक्सिजनलाई चाहिँ हरेक टिस्युमा पुर्याउनको लागि चाहिँ वी नीड गुड ब्लड भोल्युम किनकि ब्लड इज द ओन्ली थिङ द्याट क्यारीज अक्सिजन राइट सो वी आर फोकसिङ लाइक दिस Also, another one I wanted to talk about here, severe dehydration can lead to hypovolemia. I have already explained how that happens. So in case of this condition, like in case of parvo puppies, where severe dehydration, where there is like lot of vomits, diarrhea, and disrupted gastrointestinal tract, and sometimes bleeding also. That's how we see hemorrhagic diarrhea. In such cases, severe dehydration leads to hypovolemia. So in such cases, we have to be very careful while making protocol for fluid therapy. If only crystalloids are used, the fluids will move to interstitium within short time period. That is like 45 minutes. Within 45 minutes, almost about 90 to 95% of crystalloids will move to interstitium. That will correct only dehydration but not hypovolemia. So we have to correct severe dehydration as well as hypovolemia. We can follow this strategy. Initially, shock dose of balanced isotonic crystalloids, that is 90 ml per kg per hour of total blood volume for dogs and 60 ml per kg per hour total volume for cats. And then after, we can think about giving colloids of size 100 to 200 nanometer. That will retain 90% of colloids will be retained in intravascular compartment, which is also blood vessel, and that will result in better tissue perfusion as well as restoration of capillary forces and blood pressure, eventually saving a life. All right. So see, Crystal, I understood what you wanted to know. Your shock volume 90 ml per kg per hour of total volume for dogs. Your shock volume administer गर्दाखेरि हामीले चाहिँ यसको total को 25% मात्र like certain time मा दिने हो के not like within a time frame of 5 minute मा दिने हैन के like हुन्छ नि 5 minute अथवा 10 minute अथवा 15 minute sorry 5 मिनट को टाइम पिरियड में दिने हैन के हामीले चाहिँ एउटा सर्टेन टाइम फ्रेम बनाएर दिनुपर्छ यो चाहिँ पर केजी पर आवर को दरले भनेको छ नि त So यसको 25% चाहिँ हामीले के गर्नु पर्यो त टाइममा दिनु पर्यो के बोलस दिँदाखेरि पनि अब 30 मिनट्स हुन सक्छ 1 आवर हुन सक्छ हैन 2 आवर्स हुन सक्छ 1.5 आवर्स हुन सक्छ त्यसरी चाहिँ हामीले टाइममा दिने हो त्यसरी टाइम क्याल्कुलेट गरेर बिस्तारै त्यही टाइम भित्र सकिने गरी दियो भने चाहिँ त्यस्तो खालको रिस्क चाहिँ कम हुन्छ क्रिस्टल did I make sense?
Yes, Didi.
Yeah. Okay, so this is quite important point. So whenever you encounter with a parvo puppy, you can go with this. You can assess whether the puppy is in hypovolemia or it is only in dehydration wala state, and then you can make your fluid therapy protocol, because there are like I have seen when I was doing my UZ, I have seen lots of parvo puppies dying in our hospital because we lack this knowledge. I know when I went to WPS, I was able to save quite number of parvo puppies after going through this knowledge, after having this knowledge. So yeah. Okay, so I have mentioned this table. This table is also from today's veterinary practice. Okay, I follow these two magazines. Okay, one is Clinician's Brief and another one is today's veterinary practice. So these two are basically for small animal veterinarians and very updated and very and full of resource materials. Okay, you can also go through them. So in case of anemia, see, because in case of anemia, there could be hemorrhagic shock. Okay, so in that case, we can administer bolus of hypertonic saline. Dosage is given over here, 4 to 5 ml per kg IV over 10 minutes. All right. Why this is suggesting for hypertonic saline? Can anybody explain it to me? I had earlier explained about the function of hypertonic solution. So can anybody explain why this is telling us to use hypertonic saline IV over 10 minutes? What is the logic behind it? What does hypertonic solution do? सबैजना बोर लाग्यो क्या हो कसले भन्दैन त बुझे छैन हजुर
हाइपोटोनिक सोल्युसन युज गर्यो भने चाहिँ एनिमियाको केसमा त्यो यसले चाहिँ एक्स्ट्रा सेलुलर कम्पार्टमेन्टहरु फ्लुइड चाहिँ इन्ट्राभास्कुलर भोल्युममा चाहिँ ड्र गराउँछ अनि ब्लड भोल्युम मेन्टेन
यस थ्यांक यू भेरी मच थ्यांक यू सो मच है क्रिस्टल एकदम धेरै राम्रोसँग अटेन्टिभ भएर सुनिरहेछ एन्ड देन आफ्टर we can go for balanced isotonic fluid like lactated wrinkle solution. के भयो त भन्दाखेरि क्रिस्टलले भने जस्तै हाइपरटोनिक सलाइनले चाहिँ के गर्ने भयो त भन्दाखेरि एउटा भोल्युम डेफिसिट भइरहेको थियो त्यसलाई चाहिँ अलिकति नर्मलाइज गर्ने भयो ओके एन्ड देन वी क्यान गो फर ब्यालेन्स्ड आइसोटोनिक फ्लुइड त्यसपछि चाहिँ whenever we achieve targeted blood pressure we will reassess, and then if there is severe hypotension, if the blood pressure is not normal, if it is normal, then we have to consider about blood component therapy. And in case of sepsis, we can go with only balanced crystalloids, like you can use RL, you can use NS, whichever, okay, for initial resuscitation, and then you can follow all those. We have to use, we have to avoid using colloids like headspan because they might trigger immune responses. So already body is going through sepsis, and if we use those things and if there is more immune responses, then there will be like overload to the body and that will do harm only. So we have to be very careful while formulating our fluid therapy protocol that we do not harm the animal. We just help the animal to correct that. Okay. In case of kidney injury, acute kidney injury or dysfunction, if we know that animal is going through acute kidney injury, if we are able to assess that through our physical examination or laboratory findings, then we have to avoid fluid overload at all costs. If there is fluid overload, then we have to remove fluid from the body, and that thing is only done by kidney. So if kidney is already damaged, then who will do it? Animal will die. So in such cases, you have to be very careful. We could use synthetic colloids and we cannot use synthetic colloids and chloride solutions like 0.9% saline. We can go with lactated ringer solution or things like that. So this is just example, like patient wise we have to formulate fluid therapy protocol. I just wanted to give example. Yes, Vijay, yes.
मलाई चाहिँ एउटा क्वेसन सोध्न मन लाग्यो कि त्यो हामीले जस्तै एनिमिक पेसेन्टमा चाहिँ हामीले कतिको एनिमिक पेसेन्टसम्मलाई चाहिँ फ्लुइड थेरापी गर्न मिल्छ हैन। अब कस्तो खाले प्रिकसन अपनाएर फ्लुइड थेरापी गर्नुपर्छ। अब एकदम सिभियरली एनिमेटेड छ भने त फेरि अब फ्लुइड थेरापीले त्यसलाई प्रब्लम पो ल्याउने हो कि भन्ने कुरा डाउट लाग्यो कि।
या एक्ज्याक्टली एकदम राम्रो क्वेसन हो हैन। यसको लागि चाहिँ अझै धेरै एक्सटेन्सिभ स्टडी गर्न पर्ने जरुरी हुन्छ हैन। प्लिज नोट डाउन। I will also note down this question. You also please note down and do your further studies. तर के हुन्छ त भन्दाखेरि जहिले पनि ब्लड कम्पोनेन्ट एडमिनिस्टर गर्नुभन्दा अगाडि चाहिँ इन केस अफ एनिमल्स ब्लड कम्पोनेन्ट एडमिनिस्टर गर्नुभन्दा अगाडि चाहिँ अलिकति भए पनि we have to use either we have to use crystalloids. Okay, किन भन्दाखेरि अनिमियामा चाहिँ के हुन्छ त भन्दाखेरि in case of animals, whenever we are going to use blood components directly, then there could be certain type of but I'm sorry, I will answer it to you after reading about it. Okay.
हजुर, यो मैले चाहिँ एक दुईटा केसहरुमा चाहिँ त्यो प्रब्लम फेस गरेर सोधेको दिदी हजुरलाई। जस्तै अब यो गोटहरुमा मेनली फेस गरेको मैले प्रब्लम चाहिँ एउटा दुईटा केसमा चाहिँ के हुन्छ के भयो भन्दाखेरि यति धेरै एनिमिक थियो कि अब त्यसलाई अब पीसी पनि एकदम लो थियो अनि फ्लुइड थेरापी गर्न पनि हामीलाई डर लाग्यो। झन् अब हामीले गरेर मार्दियो भन्छ एनिमल ओनरले भनेर चाहिँ अनि हामीले चाहिँ अब यतिकै ब्लड ट्रान्सफ्युजन गर्न पनि अब अलि गाह्रै पर्यो त्यो कन्डिसनमा। अनि त्यही भएर यति गर्न नसकेर छोडेको कन्डिसन पनि थियो। त्यही भएर चाहिँ मलाई जस्ट डाउट लागेर सोधेको।
यस्तो हुन्छ अब त्यो फ्लुइड थेरापी गरेर त्यसलाई चाहिँ हार्म हुने भन्दा पनि केही न केही भए पनि हेल्प हुन्छ। अनिमियाको केसमा चाहिँ के हुन्छ त भोल्युम डिफिसिट त हुन्छ नि त त्यहाँनिर। अनि प्लस के हुन्छ त भन्दाखेरि अब अनिमिया पनि कुन टाइपको अनिमिया हो भन्ने कुरा पनि छ नि त। अब जस्तै ब्लड लस भएर भएको अनिमिया छ, अब त्यस्तो खालको छ भने चाहिँ यु क्यान फलो दिस प्रोटोकल।
हेमोङ्कसले गर्दाखेरि भएको एनिमिया
हेमोङ्कसले गर्दाखेरि त्यही अब हेमोङ्कसलाई ट्रिट गर्ने अनि त्यसपछि सुरुमा चाहिँ उसको यो ट्राई गर्ने लाइक यो प्रोटोकल फलो पनि गर्न सकिन्छ। यो त अब जम्मा 4 to 5 ml per kg आइभी ओभर 10 मिनट्स भनेको छ नि त 10 मिनटको टाइममा यो दिने हैन। अनि त्यसपछि हेर्ने एसेस गर्ने कि अब गोटले चाहिँ त्यो त्यस्तो गर्दाखेरि गोटले चाहिँ यदि राम्रो रेस्पोन्स गरेको छ भने कन्टिन्यू गर्ने, यदि रेस्पोन्स गरेको छैन भने चाहिँ त्यही ब्लड ट्रान्सफ्युजनमा नै जानु पर्यो। त्यही एक्सेसिभ अमाउन्टमा जस्तो नर्मल सलाइन जस्तो त्यस्तो खालको चाहिँ युज गर्न भएन हैन। त्यसले चाहिँ अब सेल्सलाई नै ड्यामेज गर्न सक्ने हुन्छ, आरबिसीलाई नै ड्यामेज गर्न सक्ने हुन्छ। सो यस्तो खालको हाइपरटोनिक सलाइनहरु चाहिँ युज गर्न सकिन्छ।
Okay, thank you.
Yeah, okay, I will read about it more, okay? Yes, thank you. So let's move to rehydration. This is basically identify and this is basically fluid replacement for dehydrated patient हैन। resuscitation पछि पनि rehydration गर्नुपर्ने जरुरी हुन सक्छ अथवा के हुन्छ त भन्दाखेरि अथवा चाहिँ already dehydrated patient present भएको छ भने चाहिँ we can avoid resuscitation and we can only do rehydration therapy. So the formula is fluid deficit in liters equals to body weight in kilogram into percentage dehydration. Okay, so this is the fluid deficit is replaced over the period of 6 to 24 hours using any appropriate isotonic crystalloids. All right, we have to keep an eye for hyponatremia and hypokalemia. You got the thing. So rehydration or replacement we can use normal saline. We can use lactated ringgol solution. I would go with lactated ringgol solution. Now next comes maintenance, which provides cellular maintenance requirements, as cells have a daily water requirement to maintain regular metabolism. When patient is not eating or drinking, in addition to correcting dehydration and restoring perfusion maintenance, fluids has to be provided. All right. Multiple units of maintenance dose can be provided to patients that may benefit from diuresis. For example, after exposure to toxins, whenever we have to flush out the toxin, we can use multiple units of maintenance along with diuretics, only when the kidney is functioning well. So dose rate is for dogs, it is 40 to 60 ml per kg per over the period of 24 hours, and for cats it is 45 ml per kg per kg over the period of 24 hours. In case of this isotonic crystalloids like lactated ringgol solutions are preferred, but should be individualized and make prescription accordingly. Like we have to do blood work, and then if there is less, like if there is reduced potassium or any other electrolytes, then we have to make a protocol like that. Likewise, let's move to calculation. So first we have to do selection of fluid types, whether we are going to use crystalloids or colloids, and then fluid volume requirement. It will include existing deficit, maintenance requirement, and ongoing losses. So see, total fluid requirement will over a period of 24 hours for an animal will be the addition of these three things: deficit in liters, that we already know how to calculate, and then maintenance. For large breeds, it's 44 ml per kg per 24 hour. For medium breeds, it's 55 ml per kg per 24 hour. For small breeds, it is 66 ml per kg per hour. For cats, it is 45 ml per kg per hour. And also, I would like to add one more thing here. These cats are very sensitive to DNS. Okay, I don't know why yet, but in practice, I have seen that a lot of times that they just collapse after using DNS. And another is ongoing losses. Those are basically diarrhea and vomition. So the formula to calculate ongoing losses are 4 ml per episode per body weight. If a 10 kg dog is had 5 episodes of vomition, then ongoing loss will be 5 episodes of vomition without any diarrhea or without significant loss in urine. Then the ongoing loss will be 4 into 5 into 10. So how much it is? 4 5 is 20 into 10, 200 ml, right?
Yes, Didi.
Yes.
Yeah, so we will get our total fluid requirement over a period of 24 hours. So see, if we have like 8% dehydrated animal, which is a large breed, and which had 2 episodes of diarrhea, then how much fluid requirement it will require over a period of 2 hours? Can anybody calculate and tell me?
Can you repeat?
Yeah, so see, we have a weight class is medium. Okay, sorry, we have a 15 kg body weight of a dog, 15 kg dog who has 6% of dehydration. And which is medium breed, who had 3 episodes of vomition and no any other significant ongoing losses. इसको total इसको total चाहिँ त्यो उ गर्नु न, total fluid requirement. Please tell me.
If you have missed the question, I have put it in the chat box as well.
I cannot see the chat box. How do I see chat box? Oh God. The chat box कसरी निकालेको त्यो weird भयो आज जुन त
एकचोटी ESC थिचेर त्यो तपाईको फुल स्क्रिन होला अनि त्यसपछि यता साइडमा आउँछ.
Yeah, I got it. Thank you so much. Yes, very good. Thank you so much. So bye. Please make it fast. I have more slides.
About 910, okay. 910 ml jati.
Okay, इसको deficit कति आयो?
0.9.
Yeah, 0.9 liters. Okay, so 0.9 liter like say yeah, dog is struggling. 0.9 liters. So it's like the के गर्नु पर्यो त भन्दाखेरि ml मा चेन्ज गर्नु पर्यो 900 ml. All right. Deficit say 900 ml भयो. Now what is the maintenance?
825. त्यो medium breed को गरेको 15 kg हो भनेर.
Yeah, 825. Yeah, good. Over the period of 24 hours, right? What is the ongoing loss? What is the ongoing loss?
$135.
180.
Yeah, 180. Correct. Yeah, now please add all of those and tell me how much it comes.
That's like 1005.9. You ml mind this okay? 1 liter जति भयो त.
Yeah. So 1905 IOA, something like that. ML, right? So yeah, 1 liter and 900 ml over the period of 24 hours. The dog will collapse. Over a period of 24 hours, right?
Yes, Didi.
So it's like God like start by giving 1/4 of the dose. Okay, start by giving 1/4 and then assess and slowly dim. Or you can follow like giving 25% and increasing 25% like that. But make sure that you give over a period of 24 hours, not like within 6 hours or 8 hours. Okay. Okay, no, okay.
Okay, Didi.
Yeah. See, अहिले सुरुमा चाहिँ एकदम confusing लागिरहेको होला हैन, but whenever you go to library and when you find these things on book, then you will be more clear. So just try to go to the library and read as many books as you can on this. Okay. And you know what, this question was asked in our anesthesia or I don't know where surgery कहाँ सोध्नु भएको थियो हामीलाई चाहिँ यो क्वेशन हैन मनोज सरले अनि I was so I could not calculate this के अहिले मलाई यस्तो रिग्रेट हुन्छ नि अहिले मलाई त्यो भएको भए कस्तो मजाले मैले क्याल्कुलेट गर्थेँ होला जस्तो लाग्छ हैन so please be attentive and try to find a way. Is it clear?
Yes,
Yes,
yeah. Okay, in practice also we calculate like this only. Okay, if a patient who is not in an emergency condition and presented to us with such dehydration and then ongoing losses, then we calculate like this. Like most of the parvo puppies ko lagi pani after assessing whether it's hypovolemic or not, we go with this formula, but it will be a bit more aggressive. Okay, let's move to our example. This example I have taken from clinician's brief. There I had found one nice article on fluid therapy. If you all want, I can forward it to you. Okay, I'll forward it to IVSC Rampur. IVSC Rampur, please forward it to all of the participants, okay? So see Gerald, a 4-year-old neutered male cat. यो फेरि माथि आयो भने
अब फेरि फुल स्क्रिन गर्नु त अनि हुन्छ डबल क्लिक गरेर
1 सेकेन्ड हो के भयो किन यस्तो हुन्छ
यो स्लाइड शेयर गर्नु अहिले यो पावर पोइन्टबाट अनि त्यो जुम को भ्यूलाई चाहिँ डबल क्लिक गर्नु त अनि हुन्छ
Okay, what? Okay, let it go. Yep. So Gerald, 4-year-old neutered male cat weighing 3 kg is presented for vomiting and diarrhea of 3 days duration. He was anorexic and lethargic prior to presentation. Okay, this is our history. So on physical examination, Gerald is quiet and has a heart rate of 120 beats per minute. What is the normal heart rate of cat? See, please tell me somebody. And please tell people except Vima and this Crystal. What is the normal heart rate of cat?
$100 to $140.
What?
150 देखि 200 को रेन्जमा हो कि जस्तो लाग्यो दिदी
या 150 देखि 150 देखि 200 रेन्जमा हो है 220 सम्म जान सक्छ प्रतीकले के भन्दै थियो
त्यही रेट भनेको दिदी 150 to 180 सम्म
yeah 200 सम्म जान सक्छ okay so yeah you already know that heart rate is low, right? Bradycardia type. And pale mucous membranes with a capillary refill time of about 2 seconds. So it could be more than 2 seconds also, of about 1. And weak peripheral pulses, initial blood pressure of 50 mmHg systolic. So what is the normal blood pressure of a cat? Tell me. Can anybody tell me? Bana. Okay, anyway, so normal blood pressure of a cat ranges from systolic one because normal blood pressure of a cat systolic भनेको चाहिँ 120 to 140 हुन्छ डायस्टोलिक भन्यो भने चाहिँ 70 to कतिको थियो यस्तै यस्तै छ रेन्जमा प्लिज चेक हैन अनि यो चाहिँ हाइपोटेन्सन या गुड हाइपोटेन्सन को स्टेट भयो and a body temperature of 94 degree Fahrenheit, so it is quite low. He is also estimated to be about 6% dehydrated based on skin tinting and dry mucous membrane. So who can tell what is happening with Gerald? Fast. We are running out of time, guys. Fast. See, okay, forget about it. See, के भयो त bradycardia छ त्यहाँनिर. One is bradycardia, 120 BPM भयो heart rate. So one is bradycardia is there, and then capillary refill time is less than 2 seconds. Weak peripheral pulses. Initial blood pressure is 50 mm of Hg. So that is hypotension, and third one is hypothermia. So hypothermia, hypotension, and bradycardia. So this is a sign of hypovolemic shock in case of cats, right?
Right.
Please do not forget. Yeah, please do not forget anything, whatever you had studied. And then now we will move to how do we make an approach? How do we make an resuscitation, and then rehydration, and then what maintenance, right? Because this cat is having 6% of dehydration also, not only hypovolemic but dehydrated also, right? So resuscitation first you would like to establish a peripheral catheter or interstitial catheter, and then you have to do active exogenous heating in case of cats, and then you would go with balanced isotonic steroids like lactated drinker solution at the dose rate of 50 ml per kg. Yeah, and then over 55 minutes using a 60 ml syringe or a fluid bomb, right? And then parameters should be reassessed and stopped if the patient has met the end goals, like if there is normal blood pressure or normal heartbeat or normal temperature, and if body temperature keep rising, then we can go for additional fluid boluses. So step 2 will be rehydration. Gerald responded well to the fluid given during resuscitation. His heart rate is now 200 beats per minute. Blood pressure is 100 mm, and mucus mm of Hg, and mucous membranes are pink. He still has signs of dehydration because he has 6% dehydration, right? So let's calculate how much he requires fluid. Fluid to replace is 180 ml, right? 180 ml, right? So its time frame was over the period of 24 hours, but here they have done over the period of 22 hours. Sorry, over the period of 12 hours. So whatever is feasible to us, we can do, but it should not be less than that, all right? 12 hours bhanda agadi nai chai garna bhayena. Also, cat matter, we have to be very careful while giving fluids. They are very sensitive and they are very different than dogs, and they are less fluid tolerant, as I already mentioned. If we use DNS haphazardly without monitoring, the cat will collapse on the table. Okay, so let's move to another slide. This is about maintenance. अब हामीले dehydration पनि correct गर्यौं. अब dehydration correct गरिसकेपछि चाहिँ we have to see for maintenance भनेको hourly fluid requirements. We have to see जबसम्म चाहिँ cat normal हुँदैन तबसम्म चाहिँ we have to keep cat on maintenance fluid. So they calculated the maintenance fluid like that, only 45 ml per kg over the period of 24 hours. This is the dose. So overall fluid prescription after treating hypovolemia is fluid deficit plus maintenance equals to 21 ml per hour for the first 12 hours. Fluid rate is then reduced to 6 ml per hour, provided there are no ongoing fluid losses. It's like the not there was neither diarrhea nor vomit. Okay. Already clear boy. Just the boy. Okay. Also confused boy. Okay, boy. I'll move to another slide.
The dots are current going time lag or already clear was last.
Yeah. Okay. So यो चाहिँ त्यही हो है रिससिटेसन गर्ने सुरुमा चाहिँ जब पेशेन्ट आइसक्छ नि त्यति बेलामा चाहिँ यु हेभ टु रिमेम्बर अल दिस साइन्स एन्ड यु हेभ टु एक्जामाइन द एनिमल एन्ड whenever you know like this is in the state of shock or this is not in the shock, just dehydrated, then you can go like that only. If that is on the shock, then you can go with the resuscitation method, and then if that animal is not in shock, just dehydrated, then you can go with only rehydration and maintenance protocol. If that animal is not dehydrated but not eating and drinking, then you can go with the only maintenance protocol. यसमा चाहिँ के भयो भन्दाखेरि हामीले रिससिटेट मात्र गरेको भए पनि हुन्थ्यो, तर के हुने भयो भन्दाखेरि यसमा चाहिँ डिहाइड्रेटेड भएको भएर पनि we have to make sure that the animal is dehydrated. Okay, let's move to another slide. That one is fluid during anesthesia. The goal of this one is to maintain cardiac output and tissue perfusion, also maintain intravenous access, as well as compensate for ongoing losses during surgery. So procedures with minimum procedures. Oh, I'm so sorry, there was something. Yeah, so goal is to maintain cardiac. Yeah, you procedures with minimal blood loss. Blood loss we have to calculate like 4 to 6 ml per kg per hour. For greater blood loss, less than 10 ml per kg per hour. It should be keep in mind that these doses are not to be exceeded, because then again we will have another complications of fluid overload. Now, fluid overload could be fatal. Let's move into complications of fluid therapy. See, because of the fluid overload, following things could happen: disruption of phosphorylation and membrane polarization, increased production of tumor necrosis factor, alpha and interleukins, altered glucose metabolism and insulin release, decreased cardiac output, increased pulmonary vascular leakage, increased renal edema and decreased GFR, increased gut permeability and ileus, decreased soft tissue healing. That is also because of propagation of inflammation, dilution of coagulation factors, and increased risk of hemorrhage. So fluid therapy could save a life as well as put a life in a danger. So we have to be very careful. Everything is in our hands. We have to be very careful while formulating fluid therapy. So these are the signs of fluid overload. One is like, see, you can see the edema, facial swelling, and this second picture ma chai chemosis bhako cha. Chemosis bhaneko chai के हुन्छ त भन्दाखेरि एक्सेसिभ फ्लुइड भयो भने चाहिँ कन्जक्टिभामा एब्नर्मालिटी देखिन्छ. ओके, द्याट्स अ chemosis. अरु साइन्स भनेको चाहिँ इन्क्रिज्ड रेस्पिरेटरी रेट एन्ड एफर्ट, पेरिफेरल or pulmonary edema, weight gain huncha, pulmonary crackles huncha on auscultation. So cats require very close monitoring. There's a smaller blood volume, lower metabolic rate, and a higher incidence of occult cardiac disease make them less tolerant of high fluid rates. Okay, in case of cats, we have to be very careful. So 10 पटक पढेर अनि बल्ल गर्ने हैन जे गर्दाखेरि पनि. So how do we discontinue fluids after having all this? High flow rates दिएको छ भने kidney issues आउन सक्छ. So flow rate सँग चाहिँ rate of the fluid therapy पनि we have to keep in mind. Abrupt discontinuation that will lead to inability of concentration of urine, and if there is inadequate intake of water, then it could result in serious problem. So sabai कुरा ध्यानमा राखेर बल्ल we have to decide whether to discontinue fluids or not. So fluid therapy should be tapered to lower than maintenance for at least 24 hours or free access to adequate quantities of water. So this is just a question for you guys to practice. I will just I'll just copy paste it on I'll try to paste it over here. Oh no. Okay, I don't know how to copy paste it.
Ctrl-C, Ctrl-V try गरौँ न त्यसरी हुन्छ सजिलो
त्यो त गरे मैले तर च्याटमा ल्याएर पेस्ट गर्न मिलेन मिला So this question is for you all to practice at home. I hope you all understood a little bit why pani. These are my reference. Yep, thank you. That is quite
Thank you very much, Didi. So it has been a long session. Basically, we have planned to have this session in 2 episodes, but due to some issues, we have to do this in only this session. So I think all of you guys have learned something from it, and especially for our seniors who are in internship. So if you have any questions, you can feel free to drop it in chat box, or you can unmute yourself and ask, or you can contact us via social media channel so that we will relay the questions to our resource person, Dr. Ranjita Didi, and we will get your answer to you. So if you have any question, feel free to unmute yourself. Otherwise, we will go for the concluding of this session.
I have a question, Didi.
Yes, Pratik.
असाइड्स म्यानेजमेन्टको एउटा भनिदिनु दिदी त्यो हाम्रो असाइड्स म्यानेजमेन्टमा चाहिँ यो फ्लुइड चाहिँ थेरापी कसरी गर्नुपर्छ असाइड्सहरुको केसमा
असाइड्सको केसमा
हजुर दिदी कहिलेकाहीँ चाहिँ फ्लुइड चाहिँ दिनु पर्दैन भनेर मतलब त्यस्तो मैले पढाएको थिएँ कहिलेकाहीँ चाहिँ दिनुपर्छ भनेर पढाएको थिएँ त्यति बेला त यो एक्स्ट्राभास्कुलरमा बढी हुन्छ अनि इन्ट्राभास्कुलरको बाहिर जान्छ भन्ने हैन एक्स्ट्राभास्कुलरमा अनि त्यही भएर चाहिँ अब इन्ट्राभास्कुलरमा दिनुपर्छ कि पर्दैन भन्ने कुरा
यस्तो हुन्छ अब ब्लड वर्क गरेर हेर्ने अनि ब्लड वर्क गर्दाखेरि चाहिँ अब हुन्छ नि हेमाटोक्रिट टोटल प्रोटिन त्यस्तो चाहिँ रिड्युस भएको छ अथवा डिहाइड्रेसन देखाएको छ भने चाहिँ यस यु क्यान गो विथ द ब्यालेन्स्ड आइसोटोनिक क्रिस्टलोइड्स हैन आइसोटोनिक चाहिँ युज गर्ने अरु यो हाइपोटोनिकहरु चाहिँ युज नगर्ने दैट विल पोज अ रिस्क सो अनि कस्तो पनि छ प्र्याक्टिसमा भन्दाखेरि एसाइटिस हुँदाखेरि चाहिँ त्यो एब्डोमिनल सेन्टेसिस गरेर ड्रेन गर्छ नि हैन त्यो ड्रेन गर्दाखेरि पनि I mean some of the veterinarians in practice they prefer giving fluids but मैले चाहिँ गर्दाखेरि चाहिँ अब त्यस्तो खालको फ्लुइड डिफिसिट भएको पेशेन्ट इन्काउन्टर नभएको भएर चाहिँ we have first done the blood work and then we have just drained the fluid. It all depends on how that what is happening in the body of the patient like
फ्लुइड ड्रेन गर्ने बेला चाहिँ सबै मतलब कति क्वान्टिटीसम्म गर्न मिल्छ कुनै कुनै बेला चाहिँ कति जस्ट बडी वेट अनुसार हुन्छ कि कति के हुन्छ दिदी
त्यो फ्लुइड ड्रेन गर्ने बेलामा चाहिँ सबै चाहिँ ड्रेन गर्न मिल्दैन हैन कस्तो हुन्छ भन्दाखेरि कसरी पो भन्ने ओके म तिमीलाई पछि भन्छु ल राम्रोसँग त्यो प्रोटोकलहरु बनाएर यस्तो हुन्छ क्या त्यो ड्रेन गर्दाखेरि चाहिँ सर्टेन पर्सेन्टेज चाहिँ ड्रेन गर्ने सुरुमा अनि त्यसपछि एसेस गर्ने अनि फेरि ड्रेन गर्ने त्यसरी गर्ने चाहिँ गरेको थियौँ हामीले हैन
हुन्छ दिदी हुन्छ
या बेसिक अनि अर्को कुरा के पनि भन्दाखेरि बडीको त्यो प्रोटिनको लेभल कति छ त्यो पनि हेर्नु पर्छ बडीको भन्दा नि सिरम प्रोटिन लेभल कति छ त्यो हेर्नु पर्छ प्लाज्मा प्रोटिन सरी त्यो हेर्नु पर्ने हुन्छ मोस्टली
हुन्छ दिदी
Yeah, and also you have to make sure that you address the underlying disease, underlying cause behind ascites, then it's all right.
Thank you, Didi and Pratik Kijudai for the question. I think there is one question in the chat box as well. It was asked during your presentation session. So the question is, can we give fluid therapy in low rectal temperature in dog and cat? It is from Dr. Subhash Singh. Didi, you got my question?
Yeah, okay. So whenever there is, low rectal temperature is also hypothermia. So whenever there is hypothermia, we have to make sure that we are actively heating animals, okay? So जब animal को चाहिँ temperature normal हुन आउँछ अनि त्यसपछि we have to give fluids. And whenever we are giving fluids, that has to be warmed before giving in such cases.
Thank you, Didi. Hope there is another question from Krishal Shrest. In acute renal failure, isn't LRS lactate ringer solution contradictive as it may further cause hyperkalemia? Please make this clear.
Yeah, very good question. This one, Crystal. First भन्दाखेरि चाहिँ LRS ले चाहिँ hyperkalemia cause गर्न सक्छ, metabolic alkalosis cause गर्न सक्छ अथवा lactic acidosis cause गर्न सक्छ. यो सबै कुराहरु चाहिँ के हो त भन्दाखेरि मिथ हो है. I'm sending you all one link. Please go through this link. यसमा चाहिँ मज्जाले एक्सप्लेन गरेको छ. के हुन्छ त भन्दाखेरि LRS ले चाहिँ त्यो पोटासियम लेभल सँग चाहिँ केही पनि रिलेसन नै राख्दैन के त्यो मतलब त्यसलाई ह्याम्पर गर्ने उसले गर्दैन. So LRS is quite safe. Please go through that link. You will be more clear. खुल्यो नि है त्यो लिंक?
Thank you, Didi. I think it's working. So there is another question from Vinay Thapa. Contradiction of hypertonic and hypotonic crystalloids. Didi, you got my question?
Yeah, so contraindication of hypertonic crystalloid is basically in case of hypernatremia. Okay, already त्यहाँनिर चाहिँ high level of sodium भएको हुन्छ. झन् hypertonic solution हाल्दै भन्छ झन् धेरै बढी हुन्छ. So yeah, that is one. And in case of cerebral edema or any other type of effusions like pleural effusions, hypotonic crystalloids are contraindicated because already there is excessive fluids in cells, and if we are giving hypotonic crystalloids, the cells will move into the solution, the fluid will move into the cell and it will cause in cell death. So I hope it's clear.
Thank you, Didi. So I think this session has been so long. Most of us may be bored. So we are going to conclude this session. I want to give all the participants a quick reminder. Please fill the form, that is feedback form, which will be also used for the certification that I have dropped. It is in chat box. Thank you, Didi, for this wonderful session. Despite of being busy all this week, so I would like to also thank Dr. Raksan Karmachare. I think he's not here, but we have delighted to have him in this session. He shared some of his insights as well. I would like to request Ranjita Didi to give some final words. And if all of our or all participants want to continue different episodes of this fluid therapy, we can go for other episodes in future as well. So please let us know via personal contact, or you can use our social media. So then I want to give this floor to Dr. Ranjita.
Thank you so much, Somnath Bhai. It was a pleasure explaining all these things to you all. But please do remember that this is not the everything about fluid therapy. You have to you have to do your self study. You have to find out the materials. You have to go through the materials to understand in a very deeper and extensive level. This is just an stimulation that I wanted to provide. I wanted to do that. Fluid therapy is quite an interesting and a very, very important important part for the people who want to go into practice. Okay, so यो भनेको चाहिँ एकदमै brief थियो हैन, अलिकति इन्साइट मात्र, स्क्रैच मात्र हो. सो भित्र लेभलमा के छ, डीप के छ, त्यो कुरा बुझ्नलाई चाहिँ you have to go through the textbook which are in the library of our college. I have seen a lot of good textbooks in our library, so please go through them and please read about it and make sure that you are able to calculate fluid, like you are able to calculate the volume of fluid required for the patient presented to you with like after that study, like next month, like make a goal हैन, next month सम्म चाहिँ मैले यसको बारेमा पढेर भ्याउँछु र म यसरी एबल हुन्छु भनेर चाहिँ make a goal, and then obviously you can achieve that. So हाम्रो भेटनेरी हस्पिटलमा आउने प्राय जसो फ्लुइड थेरापीको केसेस अथवा कुनै केसेस which might require fluid therapy त्यो एसेस गर्न सक्नु पनि ठुलो कुरा हो र त्यसको लागि चाहिँ एउटा फ्लुइड थेरापीको सेफ फ्लुइड थेरापीको प्रोटोकल बनाएर अगाडि बढ्नु पनि एकदमै ठुलो कुरा हुन्छ, because we are obviously saving the life of that animal, I know. So yeah, keep learning, keep reading books. त्यसले नै हो हामीलाई strengthen गर्ने, because you all are in university. अहिले तिमीहरुसँग चाहिँ एकदमै धेरै धेरै टाइम छ हैन, त्यही भएर त्यो टाइमलाई चाहिँ युटिलाइज गर्ने, टाइम छ, रिसोर्सेस छ, बुक्स छ, सो त्यसलाई युटिलाइज गर्ने, पढ्ने, त्यही भन्न चाहन्छु. So how do I send all those materials to you? So
Didi, you can email me and we will disseminate it via mail to all the participants. So I'd like to remind all participants, please fill the form so that we have your email ID so we can share easily. Or if anyone wants the recording of today's session or the materials, you can directly contact us via social media. We will soon send you within one day. So that's all. I think. Thank you, Ranjita Didi, for this wonderful session. So it's been a long session. So we think, I think we should end this meeting. So thank you all for this session, for your participation and interaction. Especially thank to Dr. Ranjita, despite she's been too busy this week. She agreed with us to share some insights in this session. So thank you everyone from my side and from IVS Rampur. We are going to end this meeting. Thank you everyone. Bye-bye.